Hi, I'm Adul, a house surgeon at a reputed college in Kerala. So after exams like Neet and all is over, and probably everybody is chilling at home, and I thought it would be very nice of me to put a video about what to think after Neet. As most of people, I also aimed at MBBS and dropped another year and got decent marks, but not enough to get a government seat, government MBBS seat. So I was broken at first, but later I accepted it and I researched various courses that I can get into, which are in medical field. So I first researched about Ayurveda or BAMS, and which is a very good course, but it has Sanskrit to be learned in first year. So learning a language is pretty hard for me. So I dropped the idea of BAMS and I again started researching. So finally my research ended at dentistry or BDS course, and I started to research the various subjects in it. The after days of research, I finally was into the subject, and I selected one colleges among the many different colleges that teach the course. And by the time it was counseling, I had only one college in my mind, and I had only one college and one course in my mind, and that was my current college and my BDS professional course. So now I am currently a house surgeon at my college, and from all the previous 4 years of experience I have, I thought I could have a little insight, or I could give a little insight to the upcoming students in what is BDS. So let's start. So first things first, don't ever think that you missed MBBS by a small margin, so passing out BDS is an easy peasy task. It's the biggest lie that you will ever hear, and that you're gonna say to yourself. Don't ever think like that. Like MBBS, BDS also comes with its own sets of challenges. My co-batch, like MBBS co-batch, have gone through the challenges that have been put forward by the MBBS course, and I have seen it personally. And PDS comes with another set of packages of challenges, and it starts from the very first year, from the very first day you enter into the dental college. So we will see year by wise. In first year you have oral bio, which is the subject that deals with the oral bio or oral biology, which deals with the oral anatomical environment and the anatomical structures, the embryology of the structures inside the oral cavity, and the tooth nomenclature, which is very important, that it is one of the most basic things that you learn in dentistry, and it starts from oral biology class itself. And the oral biology class comes with a practical section, which is probably the most newest thing that everyone will face in dental college. So it is tooth carving. So we had to carve the anatomy of tooth. Like each tooth has different anatomical structures, and each tooth in the oral cavity is shaped different, and the measurements are different, and we have an entire textbook dedicated to the subject alone. So we have to carve these features out of a small cubical wax, which has to be identical with the natural tooth, and we had to submit it to a practical exam as our assignment, and we had to do this in front of the external examiner as our evaluation of the oral biology practical exam, which again have vivas and spotters, etc. Then comes anatomy, physiology and biochemistry. In anatomy, basically you have general anatomy and head and neck anatomy, and neuroanatomy too. In physiology, it's general physiology, and biochemistry also, it's general biochemistry, which should be known by everyone. But the second year, again the whole scenario changes. Like in second year we start preclinical work. The whole dentistry is divided into 4 years, and out of this the first 2 years are considered preclinical, and the last third year and fourth year are considered as clinical years. So before doing anything in clinic, we usually study it in preclinical labs, and as the name suggests, we will be doing it in models and all before doing it directly in the patients. So in final year, in third year, in third year and final year, we will be dealing with patients on a regular basis, and we will be doing treatments on them. But we have to be thorough with the preclinical subjects, and the preclinical subjects usually contains conservative dentistry, orthodontics, prosthodontics, and they will teach us the various methods to prepare a cavity, or how to make a denture, or how to bend a wire, or anything depending on the subject. Along with this, you will be having your microbiology classes, pathology classes, and pharmacology classes, which are quite very important, along with the preclinical subjects like orthodontics, prosthodontics, and conservative dentistry. So the orthodontics, prosthodontics, and conservative dentistry usually almost all university have preclinical exams in second year, like at the university exam time, but there is no theory paper as such. The theory paper is conducted at the final year, part 2 time. Then comes the third year, which is the start of the clinical year. It's like a new set of challenges, but it's more fun than the first and second years, because like you will be dealing with different case scenarios rather than doing the same set of exercises on a regular basis. But it is also very crucial, and there will be a major difference between you and your MBBS co-batchmates, because your co-batchmates would be taking history and all, while you will be doing more and more hands-on procedures on the patients. And in third year, usually the subjects that we are taught are general medicine, general surgery, and along with oral pathology, which have its own importance in dental field. Third year is usually known as honeymoon period among medical students, but for us, I don't think it is a honeymoon period, because we will have a lot of patient works to do and lot of seminars, assignments to do, but we will still manage to go through that phase. And final year comes a whole set of bigger challenges, like we have 8 different subjects, and the final year is divided into 2 parts. Like in 6 months you have 4 subjects and it's university, and another 6 months, which is known as a part 2, will have another 4 subjects and it's exam. And your exams would be coming like in 1 month interval, so you will be like rushing to finish off your quotas and everything. So you will be like in very hurry, and there will be literally no time for you to do things. But even during all these things, you should always remember to get good sleep, to get good food, and to not get tensed. There will be many big things that will occur during the 4th year and 3rd year of your life, and you will get scared, you will get anger, you will get backstabbed, but it's all part of the course, and you should be able to maintain your composure rather than skipping your meals and skipping your sleep, which will actually take a toll on your health. And in my experience, I have never stayed awake or pulled an all-nighter before exams, and I always slept like 9 to 10 hours before exam day. Like it's personal preference. Like some of my friends used to pull all-nighters, but for me it's like a big no. Otherwise I would sleep at the exam hall, so I have to get minimum of a 10 hours of sleep. So I sleep like that and be relaxed as you write your exam. In final year, the first 6 months, the subjects that usually taught is orthodontics, periodontics, oral medicine and radiology, and public health dentistry, and each has its own importance in the whole dentistry field. And the second 6 months usually has conservative dentistry and endodontics, prosthodontics, Periodontics or pediatric dentistry, and oral and maxillofacial surgery. Both of these sets have its own techniques and methods to how to treat a patient and all these subjects differ in each other, and it have its own specialty, and it have its own importance in the whole dentistry field. So this is the brief overview of what consists of BDS, or what is BDS is made of. And it's not just about tooth, but it's about tooth and a vast field of biomechanics and physiology of human oral cavity. So while considering what after Neet, you can clearly set dentistry as a path if and only if you are willing to shed blood and sweat. Of course, your faculties will help you and your seniors will help you, but you should be also able to put some effort to work it out. And there should be always research before you join a course. You should be able to research about the course. You should be able to research about the topics that are being taught at the course, and you should be able to know which all colleges are the best thing and that you can get into, and this will help you land into a course which is better for you, and land into a college which is also better to you. We will discuss the various subjects, like the individual subjects that are seen in the BDS course one by one, like as in year by year, in the next video. Stay tuned. Bye.